I'm Kostis Prouskas. I'm a psychologist with a PhD in gerontology. I'm the chairman and CEO of Actios Elderly Care Units. We strongly believe that nurses are the main pillar in our service provision. In Actios, we operate with a dynamic model of operation. We usually have people living with us who suffer from dementia or other kinds of degenerative diseases. A part of this program was to teach our nurses to better recognize the behavioral and the psychiatric symptoms of dementia. We tried to do that because we wanted to establish a new way of communication between our nurses and our doctors, psychiatrists or neurologists. We wanted also to see whether the antipsychotic medication was adequate or if it was necessary. We managed to teach some of our nurses, whom we used later on as mentors to the rest of our personnel, how to identify the psychiatric and behavioral disorders and symptoms, how to describe them to the physicians, how to set new goals and therapeutic plans, and how to maintain new ways of communicating with the residents and their families. We always notice that it is very helpful for the families and the employees to understand the nature of dementia and see what really constitutes the psychiatric and behavioral aspect of it, so they learn to differentiate between the disease and the personality.
My name is Adamos Konstantinou. I'm a psychiatrist. I am the scientific supervisor in Hippocratio Therapευτήριο, that is a private psychiatric clinic. The main purpose of the program was to train nurses. Our patients are mostly demented patients, moderate to severe illness with many severe comorbidities. The final result for our clinic was the improvement in the satisfaction of our patients, the satisfaction of the nurses, and the satisfaction of the relatives of the patients.
I'm Vorvolakos Theophanis. I'm an assistant professor in psychiatry in Democritus University of Thrace. The residential house is called Stavridio Foundation, and it's run by the church. The culture of the nurses and the administration there gradually changed, and they became much more involved. After that, the culture changed, and although the aim to control the behavior still remains, which is essential for their function, the side effects and the downside of overprescribing and antipsychotic prescribing, it's much more obvious. The relatives were very satisfied with the improvement of patients' mobility and the interaction that residents, patients, most of them, had with their relatives.
My name is Antonis Politis. I am professor of psychiatry in the Department of Psychiatry of Athens Medical School. And I'm leading also the Act of Dementia, the Greek actions. The goal of the Greek joint action is to implement projects in areas that nobody till now worked in order to raise the awareness for dementia patients. We built up a program focused mostly in educate them to diagnosis and to behavioral disturbance, to recognize and to manage behavioral disturbance, and first of all, the diagnosis of dementia. And in this perspective, we use the telemedicine from the university, and it was a very, very surprising good news that the telemedicine worked very well in order to train the trainer. Training the personnel through distance is very important because we save cost, we save money, and it's very important that we can link universities that is very far from rural areas with long-term care units that are in the rural areas. They realize they can use different scales in order to understand behavioral disturbances. They use different scales in order to evaluate their cognitive status. And at the end, their patients, they are very happy to create a relationship through this process. We are thinking in the future to create a platform with the Ministry of Digital Policy in order any persons of the long-term care units, any nurse of the long-term care units, to be able to go through the platform in a very specific educational program.